Hey everyone, welcome back to Rehab and Revive Physical Therapy. My name is Dr. Luo, and today we're going to be talking about squatting. I have 5 exercises to increase your dorsiflexion and get you a deeper squat. So first off, I want to talk about a misconception that people have that the knees shouldn't go too far forward past the feet. And that's something that limits a lot of people's squats. They feel like, oh, I'm so far back on my heels, I can't do a deeper squat because I'm worried that I'm going to hurt my knees when they go too far forward. But the truth is that that's only true for people with maybe patellofemoral syndrome, where they have pain between the joint of the kneecap and the femur. But we shouldn't make a rule based on people who have dysfunction in this area. So, if you don't have dysfunction here, then allow your knees to go forward. Now, it's true they shouldn't go too far forward, but at the same time, they need to go forward because that means your ankle is bending into dorsiflexion. Ankle dorsiflexion is limited in most people because we don't really use it much throughout our normal day. When you walk, you only need 10 degrees, but if you look at someone who's a squatter and does a deep squat, they can go maybe to 20 or 25 degrees. So, if you don't have adequate ankle dorsiflexion, you really see compensations up the chain, and that can cause injury at your knees, your hips, your back, even your neck and shoulders. So how do we increase ankle dorsiflexion? Let's get into it. One thing that you have to be very careful of is not stretching your foot. So when you do the motion of dorsiflexion, you can actually see that when you hit the end range of your dorsiflexion, your foot will collapse in order to get you more of that same motion. But don't be fooled. You're not getting it from your ankle. You're actually getting it from a collapsing arch or pronation of the foot. So while we stretch and get more ankle dorsiflexion, we need to also be very careful to protect the arch, and we're going to do that by putting a towel under the arch to keep it from collapsing. So for this first exercise, we are going to be mobilizing the talus bone, which is this bone that your tibia sits on top of, and we want to move it backwards. So as you dorsiflex, the motion is a rolling motion like this, and the talus needs to glide backwards. If it doesn't glide backwards, it can actually hit the tibia and you can lose that range of motion right there. So we want it to glide back with this exercise and not hit the bone like that. So with this exercise, what we're going to do is we're going to actually use our other heel to dig into this point here. So in most people, it'll sort of be a soft spot right here on the inside of the foot. You can find it by finding your medial malleolus, or this bone that sticks out on the inside, and going straight forward until you find a soft spot right here. And then you're going to dig your heel into here and then dorsiflex, bending your knee, bending your ankle, and forcing it not to necessarily go backwards, but you're blocking it to stay in place as you dorsiflex. Another point that you can try is here, which is the cuneiform, and that's also going to accomplish a very similar thing. But as you do this, I'm going to warn you, it feels sort of like rubbing a cavity. But after a while, it won't be painful anymore because it'll be mobile and it won't be stuck, so it won't be painful. So here's how you do it. So I'm going to use my heel, dig it right into that spot right there, and then bend my knee, and like that. You may feel a little bit of popping, a little bit of cracking. That just means the joint is moving properly. So this exercise is an Achilles tendon mobilization, and what you want to do, and this is great for people who feel like their calves are tight, feel like their Achilles tendon may be a little bit tight or painful or tender. So what you're going to do is you're going to take a hand, and you're going to start by grabbing your Achilles tendon like this. So I'm sort of pinching it like this on both sides, and then all I want to do is hold it there as I dorsiflex like this. If you feel a little pain, that's normal. It might be tender or painful if you are tight, but you shouldn't feel too sharp of a pain. It shouldn't be over maybe a 4 out of 10 pain. If it is, stop,
Don't do this exercise. Maybe you have a more serious issue going on. So after you're done here, you can actually slide it up, do the same thing up there or up there, and even below all the way down to the heel. You can make sure that everything is moving and gliding smoothly.
So we have a great tutorial on how to do this. We have a whole series on how to foam roll different parts, but we have a very unique way of foam rolling, and we do it with 5 different steps. So the first step is with a prolonged hold. So all you're going to do is find a point of tension, tenderness, or tightness, and you're going to stay there. So you're going to stay here for about 1 minute and deep breathe. And then you're going to feel that tension release. If you're feeling numbness or tenderness numbness or tingling in your foot, then you're on a nerve. Get off your nerve. If you want more pressure, you can add the other foot over here, and then you can even lift your butt up, support yourself with your arms, and hold it there. All right. So that's prolonged hold. Step 2 is elongation. So you want to lengthen your muscle, and this is sort of what people normally do for foam rolling. You're going to roll it up and down. Again, if you need more pressure, you can roll it up and down like this, supporting yourself with your arms. If you're not able to support yourself with your arms, you can just sort of scoot back on your butt, using your arms to propel yourself forward and back. Just like that. Take it nice and slow. You don't need to go through the whole calf. Just find one area and elongate that area. Find an area that's tender or tight. There we go. Okay. The third one is going to be shearing. So with shearing, what you want to do is, again, find a spot that's tight, and you're going to go perpendicular to the muscle belly. So you're going to go side to side like that. You add more pressure. Go side to side like that. Just like that. And this really creates a nice release of the muscles in a different way than you would normally get with regular foam rolling. And you see it frees up pretty quickly. Step 4 is going to be rotationals. So instead of going side to side, now we're moving the whole foam roll along every portion of the body, of the belly, of the muscle, right? Muscles are 3-dimensional. They're not just a flat thing, so why foam roll it in one way only? You want to foam roll all the way around, get the soleus, get the gastroc, even a little bit of fibularis, post-tib, all of these muscles that are in your calf. You want to make sure that they're loose and independent of each other. And again, you can do it with a little bit more pressure like this. So this is a very active type of foam rolling compared to what most people are used to, which is sort of passive. And the next and final step, the 5th step, is going to be active stretching. So you want to, again, find that spot, and now we're going to pump the ankle. So ankle's going to pump up and down, just like this. Add a little bit more pressure if you need, and move up and down. So all in all, this should take about 5 minutes, 1 minute for each step, and it's pretty quick. The calf should be loose.
Okay, so now that we've mobilized the ankle, got it really loose, let's strengthen it with this exercise. It's called the praying mantis, and what you're going to do is you're going to curl your toes up, dorsiflex your ankle, and then put your foot down, and then you're going to straighten your knee, lifting your knee not with your quad, more your hamstring and your glute. And this is really going to start to teach your brain that you have a new range of motion in your ankle, and that the muscles need to hold them there. So this is sort of a general principle in physical therapy. Anytime you get more range, you need to re-educate the muscles to teach them that they have a new range and they need to work within this new range. So you can hold it. You can also do a little bit of knee bends, up and down, very slowly, working out this new range. You may feel a little bit of burn in your anterior tibialis, the front of your shin there. You may also feel a little burn in the quads, which is fine, but don't try to overuse your quads. Use your hamstrings, use your calves a little bit more.
All right, so before you actually get on the squat rack and put weight on, you need to practice the task without weight. So just because you got more range and now you can get more dorsiflexion, that doesn't mean that you're ready to do the task of squatting. So practice it without weight. Intentionally make your ankle bend, dorsiflex into your new range. So I did all my exercises on my right side, so now I feel like my left ankle is really tight. I can go so much more with my right without my foot collapsing, and then my left can only go to about there, so I should probably go back and do them on my left. And yeah, so now I can practice going deeper into my squat, allowing my knees to come forward, not too much, but enough so that my ankle is working. And I really feel a difference after doing these exercises. If you'd like to see more tips on squatting, let us know in the comments below. Stay tuned next Monday for another weigh-in video and see my progress after a week of squatting. So we're here at Rehab and Revive Physical Therapy. I'm Dr. Luo, and we'll see you in the next video.